I'm Diana Fishbein, and I'm here to talk to you today about addiction. Millions of Americans struggle with substance use disorders. Behind every statistic is a family, a community, a life interrupted. And for decades, federally funded research, treatment, and prevention programs have been the backbone of our nation's response, saving lives, restoring hope, and advancing science that shows us what truly works. But right now, that progress is at risk. For years, federally supported research has driven groundbreaking discoveries, uncovering how addiction affects the brain, identifying which interventions are most effective, and developing tools that help people heal. These investments have allowed scientists to build evidence-based treatments, guide clinical practice, and keep up with shifting drug trends like fentanyl and emerging synthetics. Without consistent federal funding, these advances stall. Promising studies go unfinished, early career scientists leave the field, and opportunities to prevent future harm simply disappear. Federal support also sustains treatment systems across the country. Community clinics rely on grants to offer medication-assisted treatment, counseling, and recovery services to people who could not otherwise afford care. When budgets are cut, wait lists grow longer. Rural and underserved communities lose vital programs, and families desperate for help find doors closed. And prevention, the most cost-effective strategy we have, suffers too. Schools, youth programs, public health departments, and community coalitions all depend on federal funding to implement evidence-based curricula, support parents, address trauma, and build protective environments for young people. When prevention dollars shrink, the consequences show up years later in rising addiction rates, higher healthcare costs, and deeper community inequities. The harms of underfunding ripple outward. More overdose deaths that could have been prevented, more families living in crisis, more communities struggling to respond without the tools they need. And the costs are both human and economic. They far exceed the investment required to maintain strong, effective systems. This is why supporting efforts to preserve and strengthen federal funding is not just a policy choice. It is a moral one. It is a commitment to science, to the health of the public, and to the millions of people whose lives depend on accessible treatment and proven prevention strategies. It is a message that we as a nation refuse to turn our backs on one of the most urgent public health challenges of our time. Together, we can protect the progress we've made. Now more than ever, it needs our voice, our advocacy, and our unwavering support. In an effort to preserve this funding and the programs so vitally needed, we formed the Addiction Science Defense Network for an exchange of information and to provide an action network for individuals and organizations that study, treat, and prevent problems caused by psychoactive substance use and other addictive behaviors. Our network includes research societies, addiction journal editors, practitioner organizations, programs engaged in training of scientists and clinicians, as well as other organizations that overlap with the addiction science community and people with lived experience. We are advocating in Congress for the preservation and ongoing advancement of addiction science, including basic prevention and treatment research, as well as treatment services and development and implementation of preventive interventions. And we are informing the public so that they too are motivated and equipped to compel policymakers to preserve this life-saving infrastructure. Please do contact us if you're interested in joining in or if you would like to support this work. Thank you so much.